the American Heart Association has recently come up with guidelines that say that a blood pressure greater than 130, systolic blood pressure, the top number, over 80, the bottom number, that's high blood pressure.
I'm Jill Angelo, host of the Genneve podcast series for women's health in midlife. I speak with the most forward-thinking experts in the health and wellness industries. These experts are helping women 40 plus feel confident and in control of their health in the most vibrant years of their lives. So join us on this journey of women's health.
This is Rebecca Dunsmoor-Su. I'm Geneve's Director of Health, and I would like to welcome today to this podcast Dr. Sarah Speck. And Sarah, I'd love it if you would introduce yourself to our audience and let them know sort of what your specialties are and how and where you practice.
Sure. I'm Dr. Sarah Speck, and I'm a cardiologist who specializes in women's cardiology and heart disease prevention. I practice at Swedish Medical Center, and I also have my own practice, Speck Health, here in Seattle, Washington.
Excellent. Well, thank you for joining me today. We're doing this particular podcast in honor of Heart Month, I guess. But I think it's always time to talk about cardiovascular disease in women. I think so many of us think of cardiovascular disease as a men's problem, but you and I both know that is absolutely 100% not true, correct?
That's right, Rebecca. In fact, more women die of heart disease every year than men.
Yeah.
It is true that men at certain ages have a slight edge on the frequency of getting heart disease. 1 in 5 men at age 45 will have heart disease, whereas 1 in 9 women. But by the time we get to be 65, it's really quite equal.
Very true. Where do you think this sort of general population myth comes from, that this is a man's disease? Do you think it's that early onset thing, or?
I think it's the earlier onset. I also think that women's symptoms are slightly different than men's symptoms. Women can have, certainly women can have the classic elephant sitting on your chest when you walk up a steep hill, but women can also have more subtle symptoms like palpitations that take your breath away. They can have undue shortness of breath doing everyday activity without any chest pain. I've had women in the emergency room tell me that if they could just burp, everything would feel fine, and they were in the throes of having a heart attack. Yeah. So it's really about knowing what your risk is and being aware as to whether or not you could be having symptoms that are much more important than what you want to believe.
So along that line, what are some of the risks that you would discuss with a woman in terms of determining her risk factors for having heart disease?
Well, certainly we divide them into those that we can do something about, i.e. variable, and those that are not variable. And the ones that aren't variable are getting older. More women have heart disease after the age of 65 and going through our menopause and losing our natural estrogens than they do at the age of 45. If you have a family history of heart disease, that is a first-degree relative had a heart attack or stroke prior to the age of 65, you're at risk yourself for having heart disease. And then if you've already had a heart attack, you're at risk of having another one. So those are pretty fixed things that we can't do much about. The things that we can do something about 80% of the time are whether or not we develop high blood pressure, whether or not we're smoking, whether or not we have high cholesterol, whether or not we have diabetes, whether or not we're sedentary, whether or not we're overweight, and how we manage the stress in our life.
Those are all excellent things that I think women probably underestimate the importance of in their day-to-day life.
I would definitely agree with you in that regard.
And then one thing I always talk to women about, because I see women throughout the course of their lives, both in pregnancy and in gynecology, is preeclampsia and its relationship to later heart disease or cardiovascular risk.
Well, preeclampsia, as you know, is not a complication that can be taken lightly. No. And it certainly isn't something that every pregnancy, every woman who's pregnant is at risk for. So it basically defines someone who already has some abnormal biochemistry in their body that could predispose them later on in life to high blood pressure, to diabetes, and to a greater risk of heart disease and stroke.
Absolutely.
So those individuals, I would like to caution, should be even more vigilant with their life choices. Don't be overweight. Continue to exercise. Don't smoke. Know what your blood pressure is. Know what your cholesterol is. Know what your blood sugar is. And if they start to get high if they start to be elevated, I should say, when you're in your 40s, that's a time when you can actually reverse those trends and really save yourself from having a heart attack or stroke later in life.
Those are really good points. I think a lot of women ask me, I'm now 55, 60, and I'm overweight, and I haven't been exercising, and I have all these risk factors. Is it too late for me to make changes that'll affect my health?
Absolutely. It is never too late to try and improve those risk factors that I talked about. If you were smoking as a younger person, just stop. If you're overweight, even losing 10% of your body weight will make a marked difference in your risk of developing high blood pressure or high cholesterol or diabetes.
Excellent. Let's address hormone replacement therapy, because I think that's a very complex issue for a lot of women. I think there's a lot of fear out there about hormone replacement therapy, partially due to the Women's Health Initiative study. And when I approach my patients about it, I talk about what can it do for you and what are the risks and which one outweighs the other. How do you approach hormone replacement therapy from a cardiovascular standpoint and talk to women about it?
Sure. Perimenopause, losing our natural estrogens, there are a lot of symptoms that can be ameliorated with taking hormone therapy. There is absolutely no cardiac indication for taking hormone therapy. So I would never prescribe it for a woman to deliberately try and lower her cholesterol or improve her cardiovascular health. Having said that, if one of my gynecology or primary care colleagues comes to me and we're taking care of the same patient, and they say, this patient would really benefit from having hormone therapy so that this woman could sleep better, her mood would improve, she could engage in exercise and more healthful behaviors, then I would say, okay, let's look at those modifiable risk factors that we know we can reduce heart disease by improving. And that would be, let's optimize her cholesterol. Let's optimize her blood pressure. Let's make sure that she's eating a healthy diet. Let's make sure that she's exercising. All of those things can countermand any potentially detrimental effect of hormone replacement therapy. The other thing that I'd like to mention is that even the Women's Health Initiative, when they look back on the group of women who started hormone therapy right after their menopause, rather than waiting until 5 or 8 or 10 years later, those women seem to have less of an impact in terms of a negative outcome for starting estrogen therapy with appropriate progesterone therapy, depending on whether or not they have a uterus. So earlier that you start the therapy, the shortest duration, and modifying and paying attention to your other risk factors, I think hormone replacement therapy can be beneficial.
And I really want to emphasize that last point you made, because I think we see that in gynecology all the time. And they are actually currently running a very large-scale study with women who started hormone replacement therapy in the way that we as gynecologists have always prescribed it, in the perimenopause for symptoms. And when you look at it from that perspective, I think a lot of those scary risks that we talked about from the Women's Health Initiative seem not to be true, even in the secondary analysis of that study. So,
exactly.
I think the main flaw of that big study, which came out and told us things that we didn't expect, was that it was using hormones in a way that we don't use them.
Exactly. And also the average age of starting hormone therapy in that study was in the early 60s.
Right, exactly. And none of us as gynecologists or cardiologists would ever have started a woman on hormones then.
Exactly. So I think a key message here is that talk to your providers about it, have your providers work together, and continue to monitor not only the symptom relief from the hormone therapy, but what are the known risk factors that could contribute to heart disease later on, and how do we optimize those at the same time?
Mm-hmm. Absolutely. And I know we've talked a lot about heart disease because you're a cardiologist. Would you mind just going over some of the other cardiovascular risks that women face as they age in terms of like stroke and things like that? Because I think they're all interrelated, obviously.
Absolutely. Stroke is also a big factor as women age. And in fact, more women past the age of 75 have strokes than men do. And it probably has to do with the fact that women develop high blood pressure more often as they age and as we lose our natural estrogens than men do. So again, that is something that we need to be mindful of. It doesn't mean because you have high blood pressure that you're going to have a stroke, but if you have high blood pressure, it's important that you and your provider talk about how to treat it and how to get it under better control. And of course, the American Heart Association has recently come up with guidelines that say that a blood pressure greater than 130, systolic blood pressure, the top number, over 80, the bottom number, that's high blood pressure. Whereas even 5 years ago, we thought it was 140 over 90. So it's important to continue to know that as you age, you are at risk for high blood pressure. It's a very potent risk factor for developing stroke, especially in addition to heart attacks. And it's something that's very treatable and something that there are over 92 different blood pressure medications, as well as losing weight, exercise, stress management, yoga. There are all kinds of things that you can do to get that risk factor under better control.
Yeah, and I like to remind women that one of the important things about getting your blood pressure under control is that strokes don't only kill people, they also cause long-term damage that can be hard to live with. It's not, all or nothing with a stroke.
That's
to live your best life.
That's absolutely true. It's the greatest cause of disability in women. And that unfortunately often happens when women are potentially by themselves, trying to live independently, and a stroke clearly changes their ability to do that.
Absolutely. I guess the last question that I have is, if a woman wants to educate herself on these things, I always try to point women to valid resources that they can access so they don't get caught up sort of in the strange stuff that you can find out there on the internet. Where do you point patients or women to learn about their cardiovascular health?
I think that the American Heart Association has done a very good job of making good material that is well researched and sound advice on their website. So that's just the AmericanHeartAssociation.org. There's no cost to join. They have readily available sound chats and things for people to engage in, and I think that's where I would send people. The other thing is if you have diabetes, the American Diabetes Association, and then of course talking to your provider. At Swedish Medical Center, we know that all of our providers are very well versed in trying to address these risk factors, particularly high blood pressure, particularly cholesterol, because we know if we treat those early on, it's like investing in your health portfolio. You're really going to reap the benefits when you get older. So that's where I would start, is on the web with the American Heart Association and then with your own provider.
Excellent. And obviously, since we're on there right now, genneve.com has several pieces, several by Dr. Speck, in fact, that help you to sort of understand heart health in menopause.
I think the thing for women, and I think you would probably agree with this, Rebecca, is that we are so busy taking care of everyone else, arranging everything else for others in our life, that we tend to neglect ourselves. And I think that it's very important to feel that you can go to your provider and that's your time. It's your time to address your risk and do what is necessary to keep yourself healthy for decades in the future.
That's an excellent way to close. I think that's perfect advice to give all women. Thank you so much for this podcast with me. I just really appreciate your time.
It's been a pleasure.
Thanks for listening to the Genneve podcast series. We welcome your feedback at genneve.com. That's GENNEVE.com. You can follow us on Facebook and subscribe to us on iTunes or Stitcher, and you'll never miss an episode. The Genneve podcast series is produced by Shannon Perry, theme music by Smitty. And until next time, watch the Genneve website for new stories and offers all dedicated to women's midlife health.